I want to, first of all, thank Chairman Upton, Subcommittee Chairman Pitts, for calling today's markup. I, along with Judiciary Committee Chairman Lamar Smith and my colleague from Georgia, Democratic member David Scott, are the proud authors of H.R. 5, the Health Act. Put simply, this country is on the verge of a medical liability crisis. We have, unfortunately, facilitated a culture, and Dr. Burgess said this earlier, where it is much easier to sue your doctor than it is to see your doctor. That might sound trite, but it's a fact. Although this has become a reality for all physicians, it has disproportionately impacted my specialty of nearly 30 years, OBGYN. The current truth that OBGYNs face is that each of them will, on average, be sued 3 times during the course of their careers. And while over 50% of these cases are eventually dropped, dismissed, or settled without payment, 30% of ACOG fellows report increasing cesarean deliveries over traditional birth, and 26% have stopped performing or offering traditional births, although altogether due to the fear of facing a lawsuit. These statistics represent one of the largest cost drivers in healthcare today, known as defensive medicine, the ordering of tests or procedures in order to shield the medical provider from a lawsuit. This fear of litigation, according to a 2010 Mount Sinai School of Medicine study, has led 91% of physicians across all specialties to practice this thing known as defensive medicine. Additionally, according to a 2008 PricewaterhouseCoopers study, defensive medicine costs $210 billion annually. H.R. 5 will help us accomplish the important goal of lowering health care costs. The nonpartisan CBO, Congressional Budget Office, has already scored this legislation, and I think very conservatively, as saving the federal government $62 billion over the next 10 years. The benefits of H.R. 5 are not just economic. A study conducted by the Journal of the American Medical Association found that meaningful medical liability reform will help increase the overall supply of physicians at a time when the current state of health care is threatening to drive many physicians, particularly those in these high-risk specialties, out of practice. According to the Center for Delivery, Organization, and Markets Research, counties and states with reform had 2.2% more physicians, and rural counties had 3.2% more physicians per capita than similar areas without reform. Furthermore, H.R. 5 would ensure full economic and medical compensation for patients while advancing the idea that patients should receive their fair share of awards. This legislation will mitigate the threat posed by those who are currently seeking to make a profit from the injuries of patients, such as hedge funds, hard money investors, and yes, some unscrupulous ambulance chasers. H.R. 5 represents a kind of reform that is gaining bipartisan support. Even President Obama acknowledged this during his State of the Union address when he stated, "Still, I'm willing to look at other ideas to bring down health care costs, including one that Republicans suggested last year, medical malpractice reform to rein in frivolous lawsuits." There is too much money being wasted on frivolous lawsuits and the practice of defensive medicine. In order to put a stop to this practice and turn our focus back to patients, I ask all my colleagues to support H.R. 5, and I apologize for going over my time. I will now recognize the gentlewoman from Wisconsin for 3 minutes for her opening statement, Congresswoman Baldwin.
Thank you, Mr. Chairman. I will confine my opening remarks to H.R. 5 and spend a little